763 new cases of coronavirus in Victoria, all locally acquired. That means we currently have some 14,368 active cases across the state. I regret to report that 4 Victorians have lost their lives with COVID-19. A man in his 80s from Whittlesea, a woman in her 70s from Hume, a man in his 60s from Whitehorse, and a woman in her 60s from Banyule. We extend our deepest sympathies and our condolences to the friends and family of those 4 Victorians. This will be a very challenging and difficult time for them. 517 people are currently in hospital with COVID-19. 101 of those are in intensive care and 66 are on a ventilator. Of the people in hospital yesterday, 66% were unvaccinated, 28% had 1 dose, just 6% were fully vaccinated. Again, the numbers tell the clearest of stories. If you are vaccinated, your likelihood of being gravely ill, your likelihood of finishing up in hospital is massively reduced. You will, there's no certainties, but you will do everything you possibly can to avoid that, and your chances of finishing up in hospital are but a fraction of those who are not vaccinated. As we move to 70% double dose and open up, lockdown ends, we normalise this, it is going to run very rapidly through the unvaccinated part of our Victorian community, and those people who are unvaccinated will be at a much increased risk of finishing up very, very unwell. So again, there's every reason to go and get vaccinated and to book an appointment today. There were 62,189 tests processed overnight. We got those results overnight, and we thank each and every one of those more than 62,000 Victorians who went and got tested, prompted by their symptoms, acting on their symptoms. That's so important in terms of our contact tracing. There were some 35,253 vaccines administered in state hubs, and then of course thousands additional in our GP network and in community pharmacy. And we thank everybody who's gone along and received either a first or a second dose. That's how we get to 70% double dose and 80% double dose faster than we otherwise would, and it's how we take some pressure off the health system, and it's how we keep you and your loved ones safe. Please book an appointment today. Nothing is more important than getting vaccinated against this virus. 83.2% of those over 16 have now received the first dose of a COVID-19 vaccine. 53% have now received a second dose. So those numbers continue to steadily climb, and we're very grateful to everybody who's playing their part as we look to get as many Victorians vaccinated as possible. Yesterday, there were some 96,000 vaccine bookings that were made, which is one of our largest days ever. 82,000 of these were Pfizer second dose bookings, which is attributable, I think, to the interval being changed from 6 weeks to 3. Bringing forward those second doses, that's terrific in terms of, again, that race to 70% and 80%. In terms of first dose appointments in state clinics, over the next 7 days, there are almost 2,000 Pfizer appointments, as I stand here now, available on the website. More than 7,000 AstraZeneca appointments available over the next 7 days as well, and more than 27,000 Moderna first dose appointments. As you would recall, we received more than 100,000 somewhat unexpected Moderna doses from the Commonwealth. We're grateful to have them, and there's those appointments are now open. Please, there's no shortage of appointments available right now. We're beyond that kind of supply constraint phase. We're now into a phase where there are appointments. You can go to more than 55 state hubs. You can go to hundreds and hundreds of community pharmacies. You can go and see your trusted GP and access those vaccines. As I've said, as we all, I think, know and clearly understand, vaccination is how we will curtail the growth in these numbers. Vaccination is how we will open up and be free. Vaccination is how we will keep people safe. Please go and book an appointment, and then of course turn up as well for your first and second dose. There are very few people in hospital very sick who have been double dose vaccinated, and that is all all the reason you need, I think, to go and play your part. We are also running a Moderna walk-up blitz this week from those 100,000 doses which we received. Those bookings relate to 10 of our state vaccination hubs in Melbourne, and they're targeted towards areas where we need to get those vaccination rates up. Now, I'm very pleased to be able to inform you, and particularly the people of Latrobe City, that their 7-day lockdown will end at midnight tonight. There are some new cases in Latrobe today. Deputy Secretary Kate Matson can speak to those in a moment, but we feel that we have a good understanding of that outbreak, and we can move Latrobe back to the regional Victorian settings from midnight tonight. So I'm very grateful to everybody across Latrobe City for the contribution they've made. It's never easy to be forced into a lockdown, but the strategy has worked. We not only wish you well, but we're able to extend that best of news, that people in places like Terralgan, Morwell, Moe and the rest of the valley, they've turned out for testing, they've got vaccinated in strong numbers, we've got control of those cases, and they can be open again onto the broader regional Victorian settings from midnight tonight. And just very quickly, I've got a couple of other announcements to make which are very important around getting our vaccination numbers up. We will be providing postcode or suburb by suburb data on the percentage of first and second doses across across the state, but we'll be targeting some 27 priority suburbs where those vaccination rates are not as high as we would like. They're below the overall state average. There are areas where we need to do more, and just like we've seen the north and the west go from, in some cases, less than 50% single dose to now well more than 75, indeed some above 80% single dose. It's been an amazing turnaround thanks to those people and thanks to the efforts of so many on the ground. Trusted voices, community campaigning, very localised community vaccination program. We do need to go even a step further and not just target a local government area but target individual postcodes. Those 27 postcodes are postcodes where the current first dose coverage rates are under 75%, and we're going to work to try and get those up as high as we possibly can, but certainly up from that 75% first dose. They cover a range of different areas, so outer suburban areas like Campbellfield or Frankston North, inner urban areas such as St Kilda and Kensington. People will be able to identify the vaccination rate in their own suburb. There'll be a new interactive map that'll be published online, and you'll be able to go and see what the vaccination rate first and second is in your local community. I'm also pleased today to be able to announce that round 1 of the Vaccination Enhancement Grants program for those priority local government areas in Melbourne have been finalised. These are the GP and community pharmacy grants to allow them to employ more staff, expand their hours, rent additional space, fill out additional space. Ultimately, they're grants that allow them to get more jabs in more arms than would otherwise be the case. Round 1 has now been finalised. There are 300 GPs and community pharmacists who will be sharing in that $1.5 million in additional support. It's common sense. It's absolutely about doing those very practical, very local things that can make a big difference to the number of people who are moving through those settings. Many GPs and community pharmacies have been supported through round 1, and many of those are located in those 27 postcodes that I just referred to. Places like Deer Park, Hillside, Caroline Springs, Rockbank in the west, Footscray, Kensington, St Kilda. So a broad cross-section, and many of those targeted grants are in fact in the very postcodes where we want to drive more vaccination uptake. That is more than we had planned to invest, more than we had first offered up, but we've been overwhelmed with community pharmacists and GPs coming forward wanting those grants. So it just makes sense to provide that funding so they can, as I said before, employ additional staff, operate additional hours. We've had lots of different stories. One primary care setting where I think there's a second floor. They're going to fit that out and turn that into a specified vaccination hub. Others that have told us they'll be able to double the number of patients that they can vaccinate each and every day. So it's just a really significant investment in getting more jabs in more arms. Now, before I ask Naomi and then Kate to speak to their respective responsibilities, I just wanted to preview, we've got two special guests with us today, Kim and Will, they've both had COVID. Kim spent a period of time in intensive care. She's well now, but her story, as well as Will, who still 18 months on deals with the consequences of having had COVID, their stories are, I think, very powerful. They're very real stories of just ordinary, hard-working Victorians struck by this virus and having to live with the consequences of it many, many months later. You've often heard us say from this podium that no one wants to get this. It is not a pleasant thing. And there are different ends of the spectrum. Some people with very mild symptoms, some people who finish up gravely ill. But it's always good to hear from ordinary Victorians. Their stories are powerful. Their stories are, I think, a great motivation, if you needed one, to go and get vaccinated. There are appointments available. We want to get to 70% double dose as quick as we can, then 80%, be open, be free, normalise this. We know that'll be a tough time for our health workers, it'll be a tough time for our health system, but there's no alternative. It'll be easier, it'll be less traumatic in our health system the more and more people get vaccinated. So for the system and the sake of our nurses, for freedom and getting this lockdown off, and to avoid becoming gravely ill, and to avoid becoming one of those, not just the sort of statistics we read out at the extreme ends, but one of those many thousands of people who's today, many months after having contracted COVID, still live with the consequences of it. For all those reasons and more, please book a vaccination appointment today. Please go along and be part of protecting yourself, your loved ones, and indeed playing your part so that we can all get back to something approaching normal. I'm now going to ask Naomi to speak to some vaccination matters, then Kate, and then we'll hear from Will and Kim.
Thank you very much, Premier, and thank you, Kim and Will, for being here today. As the Premier said, it's really when we started to talk to primary care providers and look at the applications that we received that we started to really understand, I think, the depth and richness of what this grants program is going to offer. So it will, as the Premier said, increase throughput, but it's also about the multilingual GPs and pharmacies out there who can offer additional services to those people. It's about being able to provide support and access for people with a disability. And it's really fantastic to see that so many GPs and pharmacies, particularly in some of our most vulnerable and at-risk areas, have put their hands up to be part of this. And we really want to thank them for that. I also want to do a shout out to our regional GPs and pharmacies. Tranche 2 of the grants round is now open. There are 11 local government areas that have been identified, and all throughout this week we're really hoping to see a lot of applications coming in for the same kind of grants to be made available in regional Victoria. Now, Victoria's mass vaccination centres have played a really vital role in turbocharging our rollout, and they have really been what has helped us get to our first dose rate, which is now sitting up around 83%, and will play a hugely important role in the significant number of second doses that need to occur over the next few weeks. But from this point on, the vaccination system's not going to get bigger, it's actually going to get smaller in the best possible way. So in the same way as we've seen the program move from mass vax high throughput sites to large pop-ups to smaller pop-ups, over time we'll see it become even more focused, bespoke, really reaching into some of these communities that the Premier spoke about, where we know we need to continue to do more to make sure that every Victorian and every community has the opportunity to have the kind of vaccination rates that can really make a difference. A huge part of this program has been the significant partnerships and community engagement that have occurred, and really integral to that has been our ambassador program. We have over 200 ambassador organisations who have been with us from very early on in the program, just quietly doing the work in their local communities, helping people access, understand, engage with the right information, helping people understand the pathways to vaccination, and over time really making an impact in their local communities. That work continues, and I really want to thank all of the individuals and organisations who have been quietly doing this work in the background, but who have been such a hugely important part of the program. I'm going to talk a little bit about local government areas now. We're really pleased to see that 22 local government areas have tipped over the 90% first dose coverage. 54 of our 79 local government areas are now above 80%, which is fantastic. And in terms of the progress in our high-risk outbreak areas, Wyndham has absolutely steamed ahead of the state average and now has 89% of residents who have had a first dose. As of yesterday, Casey and Cardinia were both also exceeding the statewide first dose rate with 83% and 85% respectively. And we are particularly pleased to see that Hume has tipped over to 80% first dose milestone and almost caught up to the statewide first dose rate, with 80.7 having had their first dose. And we actually really believe that the strong vaccination rate in these key areas has played a role in helping us to stabilise the outbreak in these areas. We'll continue to see first dose growth above the state average in key outbreak areas such as Whittlesea, Mitchellshire, Melton, Brimbank and Greater Dandenong. Just want to talk briefly about some of our vaccination sites. So our pop-up at the Australian Islamic Museum in Thornbury wrapped up over the weekend with over 1,100 doses delivered over 5 days. Fantastic effort by that local community. We reopened our Broadmeadows Community Hub and they're doing a great job with over 180 vaccines delivered yesterday. And our Western Bulldogs pop-up at Whitton Oval over the weekend was also a huge success, more than 2,000 doses delivered over the weekend. As the Premier mentioned, 10 of our mass vaccination sites across Melbourne have started their Moderna walk-up blitz yesterday. We have ample supply of this safe and effective vaccine. This is a really fantastic opportunity for authorised workers who have become mandated, who might be looking to get their vaccination in the next week, to come forward, walk up, get a Moderna dose at one of those 10 locations. And a big shout out to all of the young Victorians who are really leading the way with Moderna. The vast majority of people in Victoria who are taking up Moderna are young people. So if you count yourself in that category, come forward and get some Moderna. Thanks, Kate.
Thank you, Naomi, and good morning. I'll take you through some of the numbers and geographic location of the cases in today's numbers. So again, we're seeing high rates in the northern suburbs. Yesterday, 681 new cases, making up 39% of the total. This included 309 in Hume, 180 in Whittlesea, 90 in Moreland and 50 in Darebin. 29% of the new cases were in our western suburbs, or 514 cases, across all different local government areas, but 111 in Wyndham, 105 in Melton, 103 in Brimbank. Concerningly, this rate has doubled over the past 7 days. 57 in Moonee Valley, 48 in Maribyrnong and 35 in Hobsons Bay. Cases are continuing to grow in the southeastern suburbs, making up 21% of today, or 370 new cases, including 131 in Casey, and this rate has tripled and is showing the largest growth in Melbourne. As we've said before, COVID is around everywhere in metropolitan Melbourne. Please do act as if it's, at the supermarket. When you go, keep your mask on and practice your COVID safe behaviours. 63 in Greater Dandenong, 37 in Cardinia, 22 in Monash, 27 in Port Phillip, and 108 new cases in the eastern suburbs, including 26 in Knox and 25 in Manningham. Cases are also growing as a total proportion. We've got in regional Victoria, 86 new cases in regional Victoria yesterday, and there are 555 active cases outside metropolitan Melbourne. Some of the larger outbreaks are in Greater Geelong with 16 new cases yesterday, total of 61 active cases. 15 new cases in Mitchell Shire, where there is a total of 120 active cases. 14 in Shepparton, total of 67 active cases, and 9 new cases in Latrobe, again a total of 67 active cases. As the Premier said, we do have a greater understanding of the outbreak in Latrobe, and pleasingly, due to the lockdown enacted a week ago, cases have not taken off at a great rate. The cases we've seen are primarily linked. The few cases that are unlinked, we believe will be linked or in similar communities to previous cases, which is why we're going to be able to lift the lockdown at midnight tonight. It's also partially due to the great response to vaccination in Latrobe. It's grown 6 percentage points to 79.3% coverage over the past week. So while people have been leaving their home for that fifth reason to get vaccinated, and we thank the residents of Latrobe for doing so, that 6 percentage points is above the state average for growth over the past week, and those increased vaccination rates, as well as the increased doses being able to be delivered to our sites in Latrobe and Gippsland more broadly, are again one of the reasons we feel more confident to be able to lift the lockdown. With respect to contact tracing processes, we've had some initial feedback from the supermarket industry on our revised protocols that were implemented on Saturday, which take into account greater rates of vaccination and, balance the risk of being able to deliver food security to Victoria against the risk of transmission in those environments. We'll continue to work with the supermarket industry this week, but initial feedback is positive. We'll get more feedback from them this week. We'll look at how it's been operationalised, both for our contact tracing teams, our local public health units, and the supermarket industry themselves. And we do hope to be able to roll out those revised protocols in other critical industries to help keep Victoria moving and safe. We're also taking into account a lot of the feedback we've received from GPs, working very closely with the Royal Australian College of GPs, and taking into account the Tier 3 PPE in those environments and looking at enacting similar settings to our health services, whereby we might have reduced rates of furlough, or for moderate risk people who are fully vaccinated, who've been exposed to COVID, we'll look at a 5-day furlough period and then increased rates of surveillance testing in order to ensure that we don't miss any transmission. We're working on that for introduction in coming days, and we should be able to help further protect our health system and ensure that people are able to access their GPs for any health concerns. As the Premier mentioned, we often talk numbers at this stage and in front of these cameras, but they're not just numbers, they are Victorians. And I'm really pleased to be able to introduce Will and Kim today to put a face to those Victorians who have suffered COVID and to share some of their experiences. So Will, thank you very much.
Firstly, thank you to the Premier and team for the opportunity to speak today and share my story with you. I contracted COVID in March of last year, 3 days after returning home from America, where I had been studying at college in Boston, and I've been battling long COVID ever since. The initial illness was incredibly frightening. The feeling of straining against your own body, trying to expand your lungs against this invisible force, struggling to breathe. But it was, in medical terms, a mild case. I wasn't hospitalised. I was never in ICU, and I was officially cleared after a couple of weeks. And what a lot of people don't realise is that even a mild case of COVID can turn into long COVID, which can severely impact your life for far longer than you would imagine. The conversations around COVID often focus on two drastically different ends of the spectrum: hospitalisations and death on the one hand, mild symptoms and quick recovery on the other. But I'm here to tell you that the distance between these two extremes is massive. And that's where long COVID lives. And having inhabited that space for the last year and a half, take my word for it, it's not a place you want to be. Long COVID is real, it's random, and it's characterised by periods of remission interspersed with intense symptom flare-ups. It can take many forms. And for me, that meant months after my diagnosis, I still couldn't walk around the block, without getting lightheaded and needing to lie down, struggling to breathe. I was 23 and had just come off the back of 4 years of Division 1 college athletics, training 2 to 3 times a day, 6 days a week. And now I had such debilitating fatigue that I sometimes couldn't even get out of bed. These days, a relapse can be brought on by something as simple as walking the dog or going for a kick of the footy. The physical impacts are lessening over time. I can now go through long stretches where I'm mostly okay, but I'm still nowhere near normal. Long COVID takes its toll in many ways, and it's the invisible impacts that mentally weigh you down. The shame of constantly having to tell people that you're still not better yet. The frustration you feel with your own body that you just can't seem to get over this post-viral syndrome. And the constant fear and anxiety that at any moment the symptoms can come back. I know there are many who have had things far worse than I have, and I'm definitely not here to cry, poor me, because in many ways I've been incredibly lucky. Instead, I'm keen to do anything I can to help get the vaccination message out there. It doesn't matter how young you are, it doesn't matter how fit you are, and it doesn't matter how indestructible you feel. COVID can still hit you. And you don't have to be on a ventilator to have your life turned upside down for months or maybe even years. Why take that risk? There were no vaccinations available when I got sick. There was nothing I could do, nothing any of us could do. I felt so powerless for such a long time, but we're not powerless anymore. We can fight back, and we can now protect ourselves and those we love. We can get vaccinated. Thank you.
Thanks, Will. Good morning to you all, and thank you, Premier, for the opportunity to come and share my story as a COVID survivor with you. My name is Kim Hanrahan. I'm 49 and I live in Newport with my husband Dave and our 9-year-old twin boys, Sam and Charlie. Late last July, my husband and then I contracted COVID from our house cleaner. We were very careful and stayed upstairs while she cleaned downstairs, and then vice versa. She wore a mask, as did we. Although Dave had asthma, he was fortunate enough to only get mild symptoms. A few days later, I started to go downhill rapidly. By day 11, I continued to be bedridden, unable to sleep with body aches and pains that not even strong pain relief could mask. I couldn't finish a sentence without difficult breathing. I didn't know if this was as bad as it was going to get, but didn't know how it could get any worse. It was during my daily COVID call with DHHS that I was unable to talk properly. They thankfully realised how unwell I was and advised to call an ambulance straight away. With a very low blood oxygen level, I was taken to Footscray Hospital's emergency department. I was put on oxygen and given fluids, steroids and medication to help combat the disease. I went into ICU for 6 days. So lucky not to be on a ventilator like so many patients around me. My lungs had collapsed and I required constant flow of oxygen. I was regularly on a machine with an invasive full head mask with fast flowing air. COVID also stripped me of my dignity, unable to go to the bathroom or wash myself. I had to rely on the amazing kindness of the ICU nurses who cared for me at their own risk. I'm so grateful to all of them, especially those who'd gone from 9 to 5 jobs to retrain for the ICU ward's punishing 12-hour day and night shifts. I thank them for their altruism and the sacrifice on their personal and family lives. After ICU, I then spent nearly a week isolated in a hospital room as my blood oxygen was still very low. Again, looked after by amazing staff, head to toe in uncomfortable PPE for very long shifts. Every day, I desperately hoped my health would improve so I could go home to see my beautiful boys. My husband was solely looking after them in isolation, which took a toll on all of them. We were lucky enough to have a great community that would drop off food at the front door. When I got home, I was still unwell and had to isolate, which was hard, but I was home. Recovery was slow. A couple of months after leaving hospital, unexpectedly my hair started falling out, and I lost about 3/4 of it over a 6-week period. This temporary hair loss was due to the trauma my body had gone through getting COVID. And now, pre-COVID, I had no underlying health conditions and was a reasonably healthy woman. 14 months later, and I feel like I've aged 10 years. I'm still feeling the long-term effects of COVID. My fitness has been severely impacted. I have brain fog at times and fatigue, taking a lot more effort to do the same daily activities. I feel a lesser version of myself due to this horrible, debilitating disease, which makes me sad for my boys. My message to you: we are so lucky in this country to have access to vaccines and great health care. If I'd got the Delta variant before vaccines were introduced, I truly don't know if I'd be standing here today talking to you. Don't play Russian roulette with your health or of those you love. Please get vaccinated. Thank you. And I'll now hand over to the Premier for questions.
So on your behalf, thank you very much to Will and Kim for telling their stories. It's not easy to get up and talk about very dark moments in your life, but there's a theme there. No one wants to get this. And beyond that, our amazing nurses and ambos, the whole team in our health system, they do quite unbelievable work. They are extraordinary people. By getting vaccinated, you take some pressure off them. By getting vaccinated, you make their task just a little easier. It's going to be very challenging in the months ahead, but all of us can play our part in supporting those health system heroes by going and booking an appointment today. There are indeed thousands of them available. I'm happy to take any questions you have. We all are, in fact.
So when you talk about publishing data for these 27 postcodes, when is it time to send vaccination vans to the end of streets to get people vaccinated, if not now?
Well, we're doing, very soon, Bridget will be doing what we're calling neighbourhood effort, if you like. So whether it be setting up a pop-up at a strip shopping centre, we're already doing school pop-ups, we're doing lots of stuff at a very localised level. It's going to a localised level. It's becoming even more localised, right down to the neighbourhood level over coming weeks as we race to get to 70% and indeed to 80%. So whether it's necessarily at the end of your street, it'll certainly be very, very neighbourhood focused, very, very localised, and we will be reducing the effort you need to go to in order to have your first and your second dose. That's how important it is that we get these numbers up. It is important, though, not to lose sight of the fact that the north and the west, and indeed the outer southeast as well, have gone from being in a situation where they were routinely less than 50% first dose to now being not only at the state average but indeed above the state average. That is a testament to the hard work of the teams that have been doing that important work, and of course to the many tens, in fact hundreds of thousands of people who've come forward and got the first and many the second dose.
Premier, do you have any insight into why vaccination rates are lagging in these suburbs?
Oh, look, I think there'll be a whole range of different reasons. It's very difficult to, I think, pinpoint any sole factor. There'll be some people who, because of supply issues, they've only sort of become eligible in more recent times. There'll be other people who've perhaps been hesitant for whatever reason, and then there'll be others who just haven't got around to it, if you like. So there's not a hesitancy issue, they just haven't necessarily been prompted to go and be part of the program. All of those reasons, and probably many, many more. The key point here, though, is that by using trusted voices, by reaching out to multi-faith and multicultural communities, by telling stories like Kim and Will today, and having our ICU nurses like Michelle and Jackie here last Sunday, and in so many other different ways, we're trying to appeal to people that for every good reason, please come and get vaccinated. And there are appointments available, and it is a very much a localised neighbourhood strategy, one that's all about helping you to not only take care of yourself, but in turn to take care of the people that you care about the most.
At this point in the pandemic, with days of cases over 1,000, are we lagging in getting results back to people, test results, and is our contact tracing starting to get a little bit behind as well?
I don't have any advice to that end. Obviously, volume is really, really challenging, and the more cases you have, the more interviews you've got to do, the more people you've got to reach out to. So there'll be some challenge there. There'll be some stress there, just as there has been in other parts of the country. But the team are doing an amazing job. They're working very hard. They work around the clock, and look, it's still incredibly important, just as important as it's ever been, to act on your symptoms. If you have symptoms, please go and get tested as soon as you possibly can, and then isolate until you get your result. Hopefully that result's a negative result and you don't have COVID. But in the circumstance where, with as much community transmission as we're experiencing, if you do have symptoms and you do test positive, then being away from other people is critically important. There are payments to support you if you're going to miss out on work while you isolate. There are all sorts of supports and care and assistance that we will provide you, so that you can not only keep yourself safe and be well, but to protect others.
On our testing though, is this our limit? There's no more people we can put into the system? Because I think last week people were getting results within 24 hours and now it's taking several days again.
Oh, well, no, so we're still above 90% is the most recent briefing that I've had within the 24 hours, so the following day. So it could be, I suppose, not 24, it could be 36 hours, for instance. But it's still a very impressive performance in terms of our lab technicians and those staff are doing amazing work, and volumes have been very strong in terms of the amount of tests that we've put through. We can do more than we are now. It's not an infinite capacity though, and it does mean if you're processing, if we were doing twice this number, then it will take us longer to get those results back to people. The key point here is that by getting vaccinated, you reduce the likelihood of getting it and giving it. By following the rules, you reduce the spread. By all of us playing our part for just these next few weeks, we can see to the other side now. We've all just got to finish this off, and I'm confident Victorians will. The vast majority of people are doing the right thing, and I'm deeply grateful to them. The right thing now is not just following the rules or getting tested if you feel sick. It's going and getting vaccinated. That is our way out of this, and it's our way to keep people safe.
And on the numbers, today was quite a high number.
It is.
When is our peak expected now?
Well, what we might do is provide a bit of narrative in the Chief Health Officer release later on today, and perhaps if we have one of the shows here tomorrow, we might be able to have a further discussion about that and put that into some context for the Burnett modelling. Obviously, there are modelling, as we've had this discussion many times. It's based on assumptions, and you have kind of a more optimistic line, and then there's that range up to a more pessimistic outlook. These last few days and the increase in cases is very serious. Even if we're running at a 5% hospitalisation rate, that is still people that are in hospital, many of whom that didn't need to be there. Because there will be a bunch of these cases, not all of them, but a bunch of these cases where people will have just let frustration get the better of them and maybe gone and visited someone and done things like that. It's understandable in some ways, but we're so close now. And as you've heard from Kim and Will, you don't want to be getting this. We've all got to be doing everything we can to avoid it.
Are you putting these new cases down to any one particular thing though? I know you spoke about the grand final weekend when we had that big surge last week. There's also been talk of the CFMEU protests potentially being a super spreader event. What is the narrative behind it?
Well, I spoke about grand final weekend because I had specific advice from contact tracing interviews. So not something we dreamt up, but something that people had told us when they were honest through that interview process, that they had been and visited people. All I'm saying is, please don't do that. It's not everything, but it is a significant factor. These rules are there for a reason. Getting vaccinated is there for very important reasons. We're only just a few weeks away from reaching that 70% double dose. The lockdown ends and we can move to a new phase. We've just got to finish this off now. I don't have any specific advice about what may have driven these numbers. If there is a pattern, if there is a trend, then we'll be sure to include that in the Chief Health Officer release and in the coming days when we'll have somebody from the public health team here.
Are we on track with the dates October 26, November 5, they come in, have they gone out?
No, I think we're on track to hit both those targets.
On those days or earlier?
Well, that's in the hands of every single Victorian.
But what advice do you have on
we're on track to meet those targets. We may well be a little bit ahead of schedule, but again, I don't want any sense of complacency to creep in. We've got to finish this off, and that means going and getting vaccinated. If you want to bring that date forward, then getting a first dose and a second dose, because it's still within that window where the interval, you can just make it, I think, for a second dose if you haven't had a first one yet. But in any event, that's not our only target. Our other target is 80%, of course, and greater freedoms come with that. So we're doing everything we can to try and be ahead of that curve, if you like, but we just have to rely on Victorians to come forward and get their first dose and indeed their second if they're at that stage in their COVID vaccine journey.
Naomi,
how does
sorry.
the high number of cases,
it's okay.
how does the high number of cases play into that? You've always said that you'd prefer to get them lower. We've had 6 days over 1,000 and you said it is quite worrying and there's a good line and a bad line.
Yes.
Is there a chance that even if we do reach those targets, if case numbers are still high, we'll have to have some ongoing restrictions that we might not have anticipated?
Oh, look, we are doing everything we can, Annika, to deliver the roadmap. The roadmap is about delivering the national plan. We are committed to not only delivering what we've said already, but adding in, as you've seen, on various days over the last couple of weeks, ministers have stood here and talked about schools, they've talked about construction, they've talked about all sorts of different sectors, all sorts of different things we're going to do, the outdoor economy, all those things. We are absolutely committed to delivering on the timelines that we've put out there. But again, I just ask people, please go and get vaccinated. That will limit the number of cases. Please continue to follow these rules. As Jerome made the point the other day, with community transmission as wide and as deep as it is now, right across the community, this is not something that's on the other side of town. This is not something that's for someone else to worry about. It's across the whole of metropolitan Melbourne, and we just have to act accordingly. And it's no fun. No one's enjoying this. Everyone wishes it was different, but it's a global pandemic. There's only so many things we can control. So if we focus on the things we can control, like getting a first dose and a second dose of these incredibly safe and incredibly effective COVID vaccines, together with following the rules, as challenging as that is, and I get that there's fatigue out there, but we just don't have the option to convince ourselves that it's over because we desperately want it to be. We've got to get those vaccination numbers and the protection that comes with that to the highest level we can, and at 70 and 80, then we can open up. It's only a few weeks away, so we've just got to see this through. I don't believe we'll need to. At this stage, I've got no advice that we'd have to alter anything on the roadmap. I want to try and give people as much freedom as fast as I can, as safe as possible. But I don't have any advice that sees us having to alter that now.
Does the same apply with the measures we're putting into our hospital system to deal with the surge? Like this is, as we say, 1,000 cases over the last 6 days. Over 1,000 cases, over the last 6 days. Is it changing the way that you are ramping things up in terms of keeping the hospital system?
No, I think that, as you heard on Sunday from our nurse unit manager friends, Michelle and Jackie, they are ready as you can be. They'll open beds as they need to. They'll work extra shifts as they need to. They'll bring extra staff in as they need to. It's not about machines or money. It's not about tubes and PPE and beds and all those sorts of things. It's about people. And we don't have a workforce that is, unburdened by the last 18 or 20 months. Like, the last 20 months have been really, really tough, COVID and non-COVID. We've seen probably the busiest period in our health system ever over the last couple of years. So it just means that as we're in this last part, the fourth quarter, as Anthony Tassoni called it the other day from the Pharmacy Guild, people are not perhaps as fresh as they would like to be, but we can be confident that they'll get it done because they're just extraordinary. What we have to do, though, is respect that and honour that and not make it harder than it already is. And the way you do that is to keep following the rules and go and get vaccinated. They are the two things that all of us can do that'll make the work of our nurses and AMBOs and doctors, the whole team, well, that's a contribution in it not being harder than it is already going to be. And it will be very, very challenging.
Do you have any information on cases in the prison system? It sounds like there's more than 50, which sounds pretty concerning.
No, but I'm not briefed on that today, but I can have someone come back to you.
With today's case,
Go.
I was just going to say, today's caseloads, it's the highest daily caseload recorded in Australia since the start of the pandemic. Comes off a day of we've endured the longest lockdown here in the world. So why do you think the lockdown hasn't worked?
Well, the question is based on a premise that just doesn't make any sense. If we didn't have a lockdown at the moment, I wouldn't be standing up here today reporting these case numbers. You could probably add a 0 to it, if not more. So I don't accept the premise that your question is based on.
Well, what about, should we have looked at, I know lockdown fatigue has kicked in for a lot of people. We're putting it down to breaching social gatherings. Do you think if we had a...
No. See, this is where it's really important. It's not about putting it down to anything. It's what people are telling us in their interviews. It's not a conclusion I've drawn or dreamed up. It's what people are actually telling us when we sit down and talk to them about where they've been, who they've been with. They are telling us their story. And for many, that's a feature of their story. So it's not something that I'm putting it down to or something that I'm running a theory on, or anyone in our team. It's what people are actually telling us.
So do you think that's the predominant reason, though?
No, I've never said that. I've made it clear that we had a clear trend in the wake of the grand final weekend, and we talked about that openly and frankly. I've been asked a similar question about today's numbers, and the answer, similarly, I can't give you a trend as such because I'm not briefed on one. If one emerges, then we'll be sure to let you know.
Do you think if we went for a more targeted approach with LGAs that had higher caseloads and opened up those that didn't, we wouldn't have seen so many breaches occur?
No. No, I don't think there's any evidence to suggest that that would work. We tried targeted lockdowns last year and it didn't work then, and I don't think it'll work against Delta. I think we've probably had that discussion a couple of times now. Again, we're not chasing 0. That's really clear. We have more cases than we would like, but without a lockdown on at the moment, then we would have many, many more cases and many more people in hospital. So I think it's always important that we just bear that in mind. There'll be a time for that lockdown to lift, and that's when we've got 70% of the adult 16 plus population across our state, not with 1 jab, but with 2. It's only a few weeks away, and if we can just find it in ourselves to get to that point, then we'll make the job for our health professionals, because this will then become absolutely a pandemic of the unvaccinated. But that unvaccinated group is smaller then than it is now. If we opened up now, then it wouldn't be 1,500 or half a dozen days over 1,000 cases. It'd be something altogether different and altogether worse, if I might add.
Young Victorians have done an extreme...
You're all very keen today to
I'll defer to Mitch.
speak at once, but that's fine.
Do you know the vaccination status of today's case numbers?
I know, but we can try and get it for you.
Young Victorians...
And look, I think it's fair to say it'll be the overwhelming majority will be people that have not been vaccinated. That'll be the bold prediction, but I'm happy to try and get you as much data as we can.
Young Victorians are doing an extremely good job coming forward. Those
They are,
between
yes.
12 and 16, they've hit, I think, 52% first dose was yesterday's figure.
Just terrific.
Has there been any talk of including that in the figures that our roadmap is based on, given that is
so
an
we go
amazing rate?
70% double dose end of October, a couple of weeks later 80%.
But that's based on 16
Yeah,
plus.
yeah. And then if you look at the roadmap, though, there's then another just a little bit after. This is in addition to the national plan. There is the inclusion of those 12, 13, 14 and 15-year-olds at 80%. The good news is because the uptake's been so quick, I think they may finish up being on or about the same day because we have seen so many of them come forward. So, 12 and 13 and 14-year-olds are doing it. 15-year-olds, that's fantastic in really strong numbers. I've got one of those at home who's done exactly that. He gets his second dose on or about the 11th, I think. So it's really, really important to keep them safe and to keep everybody safe.
On young people taking up Moderna, as
Yep.
you mentioned
Yep.
earlier, is there some kind of hesitancy with older age groups for Moderna? Are we seeing that?
I would certainly hope not. And the message, I'm not a doctor, but the message from the doctors is very, very clear. All 3 of these vaccines work. All 3 of these vaccines will keep you out of hospital. All 3 of these vaccines will keep you safe. So whether it's Moderna or AstraZeneca at a community pharmacy, whether it's Moderna, AstraZeneca or Pfizer at a state hub or a state pop-up, a walk-in state hub, of which there are 10 to get Moderna this week, or whether it's Pfizer or AstraZeneca at a GP surgery, all of these vaccines are highly effective. They've been approved after a lengthy, detailed process. The TGA, sometimes people criticise the TGA, they're not quick enough. I think that their approvals mean more because they take the time to work out all of these issues. So getting vaccinated, as I said before, there's only a handful of people of those that are in hospital now, so 5-6%, that have had 2 jabs, and they may well have underlying health issues as well. But for the vast majority, this will keep you safe. And they're all 3 of them work. All 3 of them are remarkably effective. That's what the experts tell us.
Are you aware that IBAC has been recently investigating the dealings with the UFU over the 2016 industrial dispute?
I would direct you to IBAC if you want to ask them questions about what they're doing and not doing.
Are you aware of those investigations?
You'd need to speak to IBAC about what they are and aren't doing.
But are you aware that they've recently been investigating...
For the third time, Samaya, you would need to speak to IBAC about what they are and aren't doing. I'm not a commentator on that body. Not now, not ever.
And do you believe you've always acted appropriately in your dealings with the United Firefighters Union and Peter Marshall?
Sorry, me?
Yes.
Yes.
Will you offer your support to the IBAC investigation into the union's dealings with your government?
I've been very clear over all my time in public life that integrity agencies should have the full support of the government and every member of it. So, always.
And I guess just on that point, given this has been a long area of intrigue, essentially, it's been going on for a couple of years, do you support IBAC exhaustively investigating your dealings with Peter Marshall and reporting publicly so this matter can be put to rest one way or another?
Samaya, it's not for me to tell IBAC where they should and shouldn't investigate, do their work. They're an independent body. The name kind of gives it away. They are there to do an important job. They have very strong support from our government, support in very strong terms, and I'll be confident that they do their work diligently. They do their work as very best they can.
And do you think that report needs to be... Sorry, can I just finish on that, please? Do you think that report needs to be made public?
Well, what IBAC doesn't do, what they report on, their processes, you'd need to speak to them.
And do you believe that Tony Bates has always acted appropriately in respect to his dealings with the United Firefighters Union?
In my experience and my judgment, yes, but that's not a matter for me to determine. And again, if you want to know what and if even, then you'd need to speak to IBAC about that.
Premier, on a separate note, or does anyone want to go on IBAC?
No.
Sure.
Okay. 2 teachers in Victoria have taken legal action against the Victorian government's COVID vaccine mandate. The Supreme Court will hear their application today. They say it undermines the rule of law, it's inconsistent with the Fair Work Act and breaches their human rights. We've seen Queensland Police also follow similar legal action. So what do you make of this, and do you think we'll see highly trained specialists exit many sectors as a result?
I'm not going to be commenting on matters that are before the courts, as your question indicates. It's going to be in the court today, so we'll have that argued out in front of a judge. That's the way the court system works, not from the podium here. What I would just say is this, that we need to get these vaccination rates up as high as we can. It's not just about teachers, but you asked me about teachers, so let me make some comments in relation to that setting. Like, for heaven's sake, our kids can't get vaccinated. Our smallest children cannot get vaccinated. So why would anyone want to be in a school community contributing to the spread of this virus? That makes no sense to me. The good news is that in surveying that the Department of Education has done, 98, 99%, not just of teachers, but of the whole team, support staff, everybody who works in our schools, of those that have been surveyed, 98, 99% of them have been and got at least 1 jab. I thank them very, very much. But we'll let that process run through the courts. But particularly in environments where, you know, the mere reason that you're there to educate our littlest kids, they can't be vaccinated. So everybody who can needs to be, to keep them safe. That's a pretty simple thing. For me, anyway.
Well, what about the vaccine mandate? I mean, the retail unions were calling for an extension. They were calling just for an extension to at least this vaccine mandate, just to give people a bit more time because.
No, they've got till the 15th of October. and that's for the first dose. There are appointments available. I stand up here most days of the week and read out the thousands and thousands of appointments that are available, and there are 90, 100,000 people getting vaccinated every day. So it's really important that we get those numbers up. And one jab by the 15th, I think that's not an unreasonable timeline, and I think that people will work really hard to do that, because what they know is it's not just about doing what the government has asked you to do. It's also about doing what will keep you safe and keep you out of a hospital bed in the vast majority of cases.
There's a suggestion today from the Greens that we need to be paying our frontline medical staff more, giving them a COVID-related bonus. Is that something you would look at, given how hard and how much pressure they are under on the front line?
Well, we have a long and very clear track record of supporting our health workers, no matter what role they play in the health system, because care is delivered by teams of people. We bargain in good faith. We try and support them in any way that we can, and we continue to have discussions with relevant unions about the difficulties that our health workforce is facing at the moment and ways in which we can support them.
There are protests outside the Australian consulate in New York about mandatory vaccination. What do you say about freedom protests?
Well, so, whilst some might like to think this is just something that state governments are doing, or something that just Labor state governments are doing, that's not in fact the case. This has happened in New South Wales also, and the Commonwealth government are not having people. I don't know what the nature of that protest was, but I could assume that maybe it's about getting a visa or getting passports and things and coming here. I think Aussies may well get home without having had the jab, but if you want to come here and you're not an Australian citizen or a permanent resident, then I think your chances of getting in anytime soon without having had 2 doses are fairly low. I readily make the point that they're not decisions I make; they're decisions that the Commonwealth government make. But that seems to be the tone of comments coming out of the federal government, because we've got to do everything we can to try and limit the amount of cases.
And what do you say to people who would say their freedoms are being taken away by governments by mandating vaccines?
Yeah, look, I would just, with the greatest of respect to people, these decisions are not made lightly. They're not made easily. They are significant steps. But, freedom, critically important, yes, absolutely. But it's a complex thing in some ways. Like, no one's free to put somebody else in hospital. So that's what I'm focused on. And at some point in the future, in fact, only in a few weeks' time, we're not going to be locking people down to protect those who haven't protected themselves. I've made that point consistently. So that's where we're headed. We're going to be open. We're going to normalise this. We're going to move through that gateway, that really difficult path, and it'll be hard on our nurses and hard on our health system. We know that. But the alternative is the kind of perennial suppression of this thing, and we just can't do that. It comes at a cost all of its own, and that's not the national plan that we helped to write. So that's not what we're going to do.
What do you make of an inner city Melbourne Council wanting to charge struggling businesses up to $5,000 a year for every car park space used for outdoor dining?
Yes, I'll leave them to defend that. I don't know that they've necessarily done it yet. They've got a meeting tonight, I think, so that is a matter for them. But I'll just perhaps answer your question this way. Well, we're not doing that. We're doing quite the opposite. We're providing substantial grants to restaurants, bars, cafes, pubs to move outside and to have the best experience for their patrons they possibly can. And the reason for that is that you are at dramatically less risk of spreading this if you are outside in the open air. And we'll have more to say quite soon about some further support for that outdoor economy to operate as safely as it possibly can once we get past 70%. I think I've sent a very clear message in the answer I've provided. I look forward to them defending that to their ratepayers.
Last week you flagged some changes to the Victorian-New South Wales border. When do you anticipate to make that announcement?
I hope to make that as soon as I can. There's a lot of work going on at the moment. We have a framework in place now. That framework I think will be able to change because of the case numbers we have here. We want that to be, as easy for those hundreds, perhaps thousands of people as it possibly can be. I'm not in a position to make those announcements today, but as soon as I can, I will.
So you're a new leader in New South Wales. How will that affect your relationship with them at National Cabinet, if at all?
Oh, look, I would just say to Dominic Perrottet, it's a great honour to be chosen by your party to lead your state, and I wish him well. I've met him on a number of occasions, and I look forward to working with him, just as I'm sure all my other First Minister colleagues look forward to working with him.
Is that a question for Kate?
No more for me.
Can I just finish off? Just notwithstanding the IBAC investigation, you and your government have been pretty opaque about your dealings with the United Firefighters Union and Peter Marshall just over that 2016 industrial dispute. Do you think you need to be a lot more transparent and actually publicise both your dealings and also the reports that have been conducted into the culture at the CFA?
I'm not quite following, Samaya. Can you repeat the question? Just so I answer it accurately.
Both yourself as in government has been pretty opaque in terms of with the public outlining your dealings, the government's dealings with the UFU over the 2016 industrial dispute, those reports into the into firefighters' culture, into firefighting culture. Does your government need to be a lot more transparent and actually release some of the reports that haven't been released to date?
Well, hang on a second. Firstly, I would not agree with your contention that anyone's been opaque. Far from. In terms of the reports that you refer to, I think there's really only one report you're referring to, which is a Verioc report, which has been the subject of protracted legal action. It is not mine to hand over. It is not mine to hand up. It is the subject of legal action, and I would direct you to that legal action. And I think it is unfair for you to conclude that because we are not able, because of a court judgment, to hand over a report, that we've been opaque. I don't think that's fair.
But Parliament's powers essentially override any decisions made in court or in the judiciary.
No, well, that's not.
So
that's not quite right. But in any event, there's been court action, and it's I think I've addressed that issue. Beyond that, we made commitments. We worked to end a long, bitter, and I think a dangerous dispute. And I think having half the CFA leadership down at Fair Work Australia during the fire season instead of being on the fire ground is no way to run a fire service. We got an agreement. We've honoured all of the commitments we made to the Victorian community, like recruiting more firefighters. We value the work of our CFA paid staff, those who are seconded across, and the volunteers who work and are the lifeblood of the CFA and the lifeblood of so many communities. To suggest otherwise is not borne out by the facts. To suggest otherwise is to conveniently forget that we were tested. All of the new arrangements that we put in place, all of them, were tested in one of the longest, hottest, driest and most dangerous fire seasons we have encountered just a couple of years ago, and our fire services, career and volunteer, did us proud. And I'm certainly very proud of them. So that's a long way of saying, Samaya, I'm not necessarily agreeing with some of the conclusions you've drawn. You're entitled to draw your own conclusions. I'm also entitled to point out where I don't think they're fair or accurate.
So there is nothing that you have or haven't done in 2016 that is questionable?
I've answered that question on many different occasions.
As Victoria's leader, is it your opinion that the UFU report should be made public? I know you've just said that you can't make it public, but do you?
No, I'm not here to offer opinions on those matters. So I won't be offering opinions on those matters. I'm just pointing out the facts. And I think that the leader of the government in the upper house has gone to this in some detail just recently, where there was some debate about these matters in the Legislative Council.
Just one more on the COVID narrative.
Sure.
We've learned about the AFL house parties through contact tracing. Is it possible that protesters have played a larger part who haven't been honest with contact tracers?
Oh, look, I'd be hard to know, I suppose, if they're not. If that was the case, that would be somewhat challenging to work out. Look, all I can apply is either facts that I'm briefed, and I don't have a briefing today about any patterns. If that one comes forward, if there's things people tell us, then we'll be sure to update you as fast as we can. What I would also say, though, is just common sense tells me that if you're protesting and you don't believe that this virus is real, then you're probably not going to go and get tested. And if you do go and get tested, you may not necessarily participate in the contact tracing process. I'm not saying that's an absolute, but that's what logic tells me. I just encourage everybody to go and get the jab, get vaccinated. That's the only thing that will get us to the other side of this. And the good news is it works. All three of them work. They work incredibly well.
The Greens pushing for a parliamentary inquiry into far-right extremism. Is that something you support?
I think that matter's going to come on for debate in the Legislative Council, and as you know, my long-standing practice is not necessarily to try and interpret what happens in that august chamber. Look, what I know is that Victoria Police for a long period of time have had a significant concern about some of those elements in our community, and I'll let that debate unfold in the other chamber.
Doctors have said they want Victoria to adopt the same isolation model used in New South Wales for GP clinics. What do you make of that?
I think Kate went to that just a few moments ago. We are working with the Royal Australasian College of General Practitioners, and we'll try and have the most, we'll try and have the safest, the most contemporary arrangements that balance the risk of transmission with the need to provide as many people with primary care as we possibly can. That work is ongoing, and we'll hopefully have some positive announcements, just like we have with supermarkets. We'll make those announcements soon, hopefully.
Just one more on the process and activity. I know you've mentioned some of the difficulties with people in these crowds not showing up and getting tested, and
potentially,
and again, potentially believing in this virus. But are you able to provide any indication into how many cases could possibly be linked to the CFMEU protests activity recently?
No, I can't. But if we can in the media release that comes out later today, then we're more than happy to do that. And if there's any other trends or any other sort of sense of things coming out of that, then we're more than happy to do that. If that's it for me, then would you be terribly offended if I've got to get off to Parliament? So I might leave you in the capable hands of Kate. Thank you. Thanks, Jim.
Just quickly ask Kate, are you aware of any further students that tested positive ahead of today's GAT?
I'm not aware of any in today's numbers.
Okay.
And do you have any background, Kate, just on what's contributing? Obviously, an almost 400 jump in the past 24 hours. Last week, we were very sure that it was grand final parties that were contributing. How come no insight this time?
Look, I think it's to be expected. The jump we saw last Wednesday would then mean in another cycle of transmission that we were expecting an uptick Monday, Tuesday, Wednesday of this week, and unfortunately that has followed through. Transmission events, people aren't aware often that they've caught it, whether it's been at a workplace or through a household or through a grand final party. People may not be aware that COVID was there at that party and that they've taken it home with them. So we're not surprised by today's jump, although of course it is disappointing.
So does that mean it could be linked back to the long weekend issue, the same one that we spoke about last week then?
Oh, it could be, but at this stage there is significant community transmission. So to be able to point to exactly one event, we wouldn't be able to do it, but it was, if you like, a super spreader event in time, even if it wasn't a super spreader event, linked to one thing like an MCG event or a geographic location.
Where are we at with just the ref at the moment? What is it looking like? How many people is each COVID case passing this on to?
Yeah, I don't have that with me at this stage, but we can get you that.
Do you know how many secondary close contacts we have currently isolating?
We've got a total of 38,000 close contacts. Secondary I don't have. We often these days ask people to contact their secondary close contacts themselves. As stated before, we iterate as the cases increase in terms of our contact management approach. So our secondary close contacts may not all be on record, as we ask people to advise them and go and get their test themselves.
The Premier was just saying before that our contact tracing is at this stage keeping up, but if we're relying on people to contact their own close contacts, how is that us keeping up?
As the public health risk changes, the process needs to change. As the Premier just mentioned, we're no longer going for COVID zero. When we were a few months ago in an outbreak, always attempting to get to COVID zero, we would take really risk-averse approaches, both to exposure site management, contact management, etc. So we have changed in terms of the volumes to deal with the highest risk, and that is obviously on primary close contacts and tier 1 exposure sites. Just as Brett discussed yesterday, that tier 2 exposure sites would no longer be listed on our website. We are focusing on the highest risk of transmission and our most sensitive settings. So we will never lose focus on our most sensitive settings, be it schools as they go back, or aged care facilities or healthcare facilities.
So should people expect then, if you're found to be a COVID case, unless you live under the same roof, you shouldn't expect a phone call from the Department of Health at this point?
No, primary close contact doesn't necessarily need to be someone under the same roof as you. It might be someone you've spent significant amounts of time with. The secondary close contact is then the contact of the primary close contact. So it's those people who may not be getting direct contact from the Department of Health.
And where are we at in terms of contacting those confirmed cases themselves? We're hearing reports of people not getting that notification until days after they've had their test, that sort of thing. What's the time frame at the moment?
Well, a confirmed case, the turnaround time on a test does take a little bit longer than a negative test. That's worth recognising. So while our turnaround times are still approximately 90% next day, we will find that the confirmed cases have a longer turnaround time. That's because the labs go through additional processes to make sure that they have verified that test as a positive test result. So they're always going to be a little bit longer. I believe the average turnaround time for a confirmed case is somewhere around 36 hours.
Just on the Tier 2 sites, you mentioned they're no longer going online. Will people that check into those venues still get notified by text message?
Yes, absolutely. Please continue to use the QR code system because that is an automated system. So where we know about an exposure site, you'll get that text to go and get tested.
And pay attention to that even if it's not on the exposure list?
We have been saying that for a number of weeks now. So we've always been listing the highest risk exposure sites on our public website, but you still may get a text even if it's not listed.
And just to clarify, can we just go through those new isolation rules for supermarket workers?
So we're trialling or piloting, if you will, a new protocol whereby we've introduced a moderate risk category for those people who are fully vaccinated and were properly wearing masks. So those people, if they were in a room with someone for a shorter period of time, they may need to go home, isolate for 5 days, and then may be able to return to work after a negative test after that 5 day and participating in a surveillance testing program as they've returned to work. So that's based on risk associated with mask wearing, associated with the time spent with a contact, as well as full vaccination. Those rules don't apply for those people who are not fully vaccinated.
And so obviously that's been flagged for schools. What other sectors can we expect to see?
We're still working through the critical industries that will be able to participate in those revised protocols. It won't be every industry. Again, it'll be those critical industries that help keep Victoria fed, help keep Victoria moving, and so on.
I just wanted to clarify something with Naomi, that's all right. You mentioned before, Naomi, that from this point on, the vaccination program's not going to get any bigger but smaller in a possible way. Does that mean we're going to see some mass vaccination hubs close or modify?
Possibly. I think that certainly not in the near future. We won't be closing down any of the mass vac sites because we have got so many dose 2s to get through. So we'll still see them there for a few months. But I do expect that as we get towards the end of the year and into early next year, we will have less mass vac sites. A key feature of our system in Victoria has always been that our sites are quite flexible. So even sites like the exhibition buildings that we might have opened up with 20 cubicles and then over time that's grown to 40 or 60, we've now got the opportunity to kind of scale back but still maintain that as a point of access and a site. So that's the other way that we will sort of manage the capacity of the system to right size it to be able to service the significant number of second doses, but also we still have lots and lots of people coming through our mass vac sites to have first doses as well.
But wouldn't we need these sites for the booster program too?
And that's a really key consideration. So third doses and boosters is something that is very likely to be part of the COVID vaccination program going forward. There's significant work happening now with the Commonwealth Government around what that looks like. What is the role of primary care? What's the role of more traditional vaccination programs? And what would be the role of mass vaccination sites in the program going forward?
For the staff who are currently in the mass vaccination hubs, will they be redeployed into hospitals and other frontline positions with the expected spike in hospitalisation? And I guess are you essentially reprioritising where staff are put?
So to some extent that's already happening in some places. So some nurses who have been working in vaccination are being redeployed back into hospitals, back into wards. I think that we have spoken about a few times here the alternative workforces, so students and allied health providers who are an increasing part of our vaccination workforce, doing an amazing job. And so our vaccination workforce is really made up of lots and lots of nurses, absolutely, some of whom might need to go back to the acute settings over time, and some of whom are already doing that. But there are still lots of other authorised workers who are continuously being trained up to participate in and support the vaccination workforce. So there's no risk to the vaccination program. There will be enough staff to keep delivering and keep on providing that access for all Victorians.
So you say there'll be enough staff, but there's going to be less staff. If I understand you correctly.
Yeah, I mean, over time there'll be less staff because there'll be less doses administered over time, but there'll be perhaps a different mix as well. So the mix of highly trained nurses compared to, say, student nurses will shift over time. Now, there are obviously really important protocols in place around supervision. So for alternative workforces, students, allied health, etc., there are guidelines around what those supervision requirements look like. Obviously, we have many highly skilled nurse immunisers in the system, and they provide that really sort of top layer of supervision, which means that sitting underneath them we can have students, we can have paramedics, we can have allied health workers providing that vaccination. And of course there will still be many nurses in the system. Not all nurses will want to or need to go back to work in acute settings.
Are you aware of if any vaccination clinics or hubs have been forced to close due to staff isolating over the last few months?
No, not that I can think of, not that I'm aware of. No.
Could I ask some questions if that's okay?
Oh, can I just ask you one question? Last questions. Oh, sorry, I'll be really quick. So could you just give me a number of staff that will be redeployed from vaccine hubs to hospitals?
We can come back to you with some detail on that, so we could provide some more information about what the staff mix is and what's been happening and what's likely to happen in the future.
Thank you. Can I ask Will some questions about the COVID experience or no? Can I ask the case study some questions about COVID, if that's okay?
Right.
I just wanted to ask you how you feel when you hear that people are waiting for the vaccine, or they don't want to get it, or they think they're young enough and fit enough to fight COVID off.
I mean, look, I think personally, obviously, I have a pretty severe reaction to that. But I mean, I get it. I think it makes sense. There's a lot of data that shows that younger people, there are chances you will be okay. And I do have a lot of friends in America that do have it and are fine. But there's no way of knowing which side that you're going to fall on. And I just think when I hear that, it's kind of like, well, why roll the dice? Why take that chance when there's something actionable that you can do now to really limit any impact going forward?
And can you talk us through physically what you're feeling now in long COVID people? Like you said, just think they're going to get it and they're going to be okay. But can you tell me how your day-to-day is affected by having long COVID?
Yeah, I think it's a lot of it. It's unseen, and it kind of changes to the way that you operate as a person. I think beforehand I was incredibly, extroverted and very active and liked to be with people and be outside and doing things. Speaking to Kim, with a very similar experience, and it changes the way that you operate, because you have to now start budgeting your exertion, whether it be with people at work or activity, because you don't know what's going to set you off, and you don't know what's going to drag you back and bring on another bout of flare-up of symptoms. And I think that's why it's so draining constantly, because you're sort of always on edge, and you can go through a period of, earlier this year I had a period sort of February, March, April where it was really good, and then I sort of got to May and then bang, it was like 5 weeks of hell. So.
And when you say you're dragged back, what is that part like for you? What is that you bedridden? Is it tell me physically what it's like?
So for me personally, I think it takes different forms for a lot of people, but for me personally, it's debilitating fatigue. It's difficulty breathing, so chest tightness comes back a lot, and sort of just never quite feeling that you get enough air. And I think you're so conscious of it mentally, and every time you breathe, and just think about how many times you're sitting here breathing per minute that you don't even think about, but suddenly all this comes back, and you're so conscious of it, and it just it's incredibly scary, frightening.
Ongoing medical care, like are you having to have regular checkups, things like that, with a specialist or anything to keep on top of this stuff?
So I can speak to the Alfred Hospital in Melbourne has been awesome, and the team there, we've done more tests than I would have thought of, but I think that one thing I'd point out is that all those tests have come back fine, and that's why long COVID I think is so nefarious in its in the way it affects you, because you can't point to anything in the data that says, yep, that's where it is. I've had chest x-rays, lung scans, VO2 tests, lots of other ones, and we haven't been able to find anything. And that's really frustrating.
Obviously, this disease in itself, we're still learning so much about it, the virus, but do they give you any indication as to how long this might be your reality for?
Well, I think in March last year when I first got it, the nurses said you should be fine in 2 weeks, and then I called them in 2 weeks, and they said, all right, well, we should expect it to be next month. Next month I called, and it's kind of from there it's gone on, and the reality is I don't think we know. On the one hand, that's really scary because it could be indefinite. I'm trying to be positive and hope that there has been a slightly positive trend over time, and there's no reason that can't continue. But I think we don't know, and there's more and more data and evidence and anecdotes coming out every day about how it affects different people for longer periods of time. But I think I haven't been given any indication of when it will stop, and I don't know when that will be. I hope it's soon, Yeah.
And just to confirm, so you became unwell when you were in hotel quarantine, is that right? Or?
So I actually came back before hotel quarantine was in place. So I was at home with my family, and then started to feel sick after a few days.
And did they end up getting infected as well?
They didn't, and that's actually probably a good point to raise, because we social distance. I think when I first got home, my mum and my stepdad sort of, stood back, and they didn't want to hug me, and I thought it was pretty ridiculous at the time. And isolated in my room, and then after a few days started feeling sick, got a test, it was COVID. They didn't get sick. And so I think it speaks volumes to that social distancing measures, doing the right thing actually does work and can have an impact.
And Will, can you just confirm your age for us? Are you 24 now?
I'm turned 24 now, yeah.
Thanks so much. Well done, thank you.
Thanks, guys.
Yeah. Nice. Thought I'd just see how much.